Suhaila, you have two bachelor's degrees and also a master's degree, and I understand you're also a candidate for a PhD. Is that right?
Yes, that is.
I wonder if we could start off, please, to talk about your qualifications.
Okay, so I have an undergrad in psychology as well as an honors in psychology. And then I completed my master's summa cum laude in 2006. And I'm currently pursuing a PhD with Professor Stephen Collins, who is an expert in the field of child sexual abuse on the grooming or victimization process of child sexual victims.
That sounds rather focused. And would you limit yourself to that, or what would you like to be doing with your future career?
So, one of my passions or specialized areas of interest is the field of child sexual abuse. So, my practice is focused around the fields of depression, trauma, sexual abuse, and addiction, as I found that those areas go together quite strongly. So often abuse victims will seek addiction or will become depressed, or there's some level of trauma, and you find a play out between all these diagnoses. And so my practice lends to those areas of speciality. And my doctorate is a testament of that.
I see. So you're covering a wide range. The clinical psychology experience that you've had in South Africa, could you describe what it covers? So what territory does it generally cover? Your experience, in other words, so far, because you've been doing this for what, 16, 14 years?
About 14 years, yes. So clinical psychologists in this country are trained across a plethora of issues that range from your day-to-day interpersonal difficulties all the way through to the more severe forms of psychopathology and mental illness. We're the only psychologists in the country that are trained educationally, so we're able to perform scholastic assessments, IQ assessments, standardized assessments in learning disorders, reading, math, spelling, day-to-day difficulties. So workplace stress, high functioning individuals who seek coaching, and then the more severe forms of psychopathology, your addiction, your major depressive disorders with psychotic features, your psychosis, your personality disorders. So it runs that plethora of experiences within that professional scope.
I wonder if we could jump into some of your larger achievements. What comes to mind with regard to achievements as far as something you're proud of, something where you made an impact, that sort of thing?
I can think of two specific experiences, both pertaining to children. So in my practice, I see children, adolescent, adults, I see across the lifespan, but children and adolescents are my passion. So the first one would be around a teenager that was admitted into hospital, into an eating disorder unit. And I was part of that multidisciplinary team where there was dietitians, doctors, and they had called me in because the patient was malnourished, kept eating but gagging, and I was called in to do the assessment with regards to the eating disorder. And for me, this case represents most strongly how the voice of the child or the voice of the adolescent is of paramount importance. So when I was engaging with this teen, she was saying quite strongly, I don't have an eating disorder. I'm not starving myself. I'm not making myself purge and vomit. This is happening and I don't want it to happen. She did not have a perception that she was fat. She did not have any body dysmorphic issues. And so I delved a bit further and I went into her history. And in doing so, I discovered that she had high levels of anxiety and that she would pull her hair, which is what we've diagnosed as trichotillomania. She also, however, was ingesting the hair that she had pulled out. And when I asked for a scan to be undertaken, they'd found that the hair had formed a bezoar, kind of like the ball that cats get, the hairball, and it had lodged in her alimentary canal. This was what was preventing the absorption of nutrients and what was making her gag. So she was being incorrectly diagnosed, but no one was listening to what she was saying. And this goes back to me about what person-centered psychology, what Rogers says is that you've got to be an empathetic listener, an attentive listener. You've got to really hear the voice of that child, the voice of the teenager. And once they discovered what the issue was, she was moved out of the eating disorder unit because she wasn't presenting with anorexia or bulimia, and she could receive the treatment that she actually needed.
I feel that I'm talking to a master of something that you're very passionate about. Thanks for that story.
Passionate but a master, definitely not. I'm a lifelong learner, and I love and I'm passionate about psychology. And then the second one, which spans then across my career as it's one of my interests, is the forensic or justice system, and what was based on my master's dissertation. So my master's dissertation was based on the disclosure process of child rape victims. So South Africa as a country has high levels of sexual violence, particularly in relation to women and children. And my first case was a 4-year-old, and 4-year-olds are not seen as the most credible of victims simply because of their age. And whilst their age may be a limitation, I certainly don't believe it should limit the child. And so I facilitated a disclosure process using anatomical dolls, just getting insight using play therapy, working with the child, allowing her voice to come out quite strongly. And the perpetrator was not only sentenced, but that disclosure and that conviction allowed for other children to come forth and say, this is what the coach had done to me as well. And it allowed the voices of children collectively to be heard and validated, and to have that conviction take place.
So this is something that began in the office with concerned authorities, maybe parents, and then it continued on right on into the judicial process with a conviction.
Yes. Something that's very rare in our country, because you can buy case dockets for literally 50 Rand. So it's something that, when I see the parents of children, especially when I'm out and about, and it could be my child patients from years ago who are not often child patients anymore. I may have seen them as 10-year-olds and they're now 24-year-olds, and I'll have the parents stop me sometimes when I'm trying to buy underwear in the middle of a store. And we kind of have this weepy moment where mom says, thank you. You picked up that there was an ADD, ADHD. You picked up that there was a learning disorder, and we thought our child was naughty. No teacher wanted our kid in their class. Our kid wasn't invited to the play dates or to the birthday parties. And once that intervention took place, once there was medical intervention, either with Concerta or Ritalin, once we had remedial therapy, if it was a learning disorder, once you dealt with whatever emotional kind of intervention that was needed, we saw a new child birthed from this intervention, a child who succeeded in class, a child who made friends with peers, a child who achieved marks that we never thought possible. And then we've kind of got a teary me and a teary mom, and we're all hiding our underwear because we're in the middle of a chain store. And this is what I live for. I live for children and adolescents. Not to say that my adult patients aren't important to me, but I think when you are able to intervene in the life of a child, there is nothing more validating, and there is nothing more blessed to have had that opportunity come by your way and to be able to make an impact. And it has a ripple effect on the entire family and on the community. So just blessed to have been part of those experiences.
Suhaila, your experience is very broad, and you seem to be young, energetic, passionate. Were you drawn to this at an early age? Could you talk about the origin of your passion? Do you have an early memory of that? I'm wondering if we can tie this success you've achieved back to some person or period of your life.
Absolutely. I was 12 years old and I received my first Jonathan Kellerman novel. And Jonathan Kellerman writes about Dr. Alex Delaware, who's an LA-based clinical psychologist, and his best friend, who's a homicide gay detective. And so all the kind of taboos and stereotypes, and details their adventures between serial killer masterminds, psychopathologists, sociopaths, Munchausen's by proxy, where parents actually make their children ill so that they can get sympathy. And so I sat there completely gobsmacked. And I was like, this is who I'm going to be. And I remember I had a little diary with hearts and squiggles, and I wrote Suhaila Latif, clinical psychologist. If you can dream it, you can be it. And from that day, every course that I took, every community service that I participated in, every kind of strategy was to make that vision a reality, to be Suhaila Latif, clinical psychologist.
And here you are today. What a journey it's been. And you're still on the journey going to your doctorates now.
Yes, absolutely.
The other thing I think that employers would like to know is about the process of your coming over. I guess, firstly, the part about registration. Have you started the registration process with Psychology Board?
Yes, I've sent off my application to the New Zealand Board of Psychology. It's in Auckland. It hasn't made its way to Wellington, I think, because of the lockdown level. As soon as it reaches there, I'm in contact with somebody in the board who has said she will acknowledge receipt. She said a minimum processing time, if all goes well, barring additional kind of lockdowns, would be 2 weeks, and a kind of maximum, if we're including further lockdowns, would be about 2 months. So by the end of October maximum, I should hopefully be registered with the New Zealand Board of Psychology.
Okay, and it could be 2 weeks from now.
It could be, yes.
Your decision to immigrate into New Zealand, this is a permanent decision. I guess you'll be bringing people with you as well from your family. You probably
Yes.
have talked about this before. How did this decision come about, and how did New Zealand get to be lucky enough for your target, your first target?
And I feel lucky enough that New Zealand would consider me the opportunity, or afford me the opportunity. So immigrating, especially when you are a mother and a wife and a sister, and all the hats that women tend to wear, is not what you would call a Mickey Mouse decision. It was one that spanned many conversations back and forth with family, friends, my partner, my children. And it stemmed from multiple kind of occasions. The one in which I love the infrastructure of the public healthcare system in New Zealand. I would have stayed on in the public healthcare system in South Africa if we had the kind of safety. It's very scary working here, especially as a woman, because of our high levels of crime. There's often also moratorium on posts because of corruption. So ideally, I would love to be in the public system, working with people. That's my passion, to be at grassroots level. So that was the one thing. It's just the infrastructure of the district health boards, which seem totally amazing, from somebody on this side. And then the other was that about a month ago, we'd had a series of quite astronomically high unrest or anarchy. And my children witnessed a man taking a hammer to the head. And as a mom, that horrified me. And as a psychologist, I'm too aware of the developmental trauma that can arise from that. But what was of significance is that 30 years ago, as an 8-year-old, I was carried out of primary school by a police officer when intergroup fighting spilled onto the school ground. And there was kind of a mass amount of dead bodies. And I looked at my husband with tears in my eyes and I said, this vicious cycle has not ended. As an 8-year-old, those memories scarred me. And here I stand as a mom of a 10-year-old, an 8-year-old, and a 6-year-old, and they've witnessed the exact same thing. How many generations must bear witness to this horror? And so part of it was the law of the district health board, which for people in the district health board might seem, miraculous, but I am blown away by the kind of infrastructure New Zealand has, especially with regards to mental health and wellness, the kind of systems that are in place. And then on that personal level, for wanting more and wanting better as a mother, as a wife, and as a professional.
Suhaila, thank you very much for sharing. Soon to be Dr. Suhaila Amir. Thank you for sharing. This has been so nice to hear from you, especially with the passion and the depth of knowledge that you've acquired from 12 all the way through, and you're not finished yet, and you're coming to gift your passions and skills into the New Zealand culture and profession. I really appreciate your time. Is there anything else you'd like to let employers know that maybe we haven't covered yet? Do you have any last comments that you'd like to say for a New Zealand employer that might be looking at this?
Well, for starters, in addition to the infrastructure, I'm also blown away by the kind of treaty of Waitangi that exists. I'm not sure if I'm pronouncing it correctly.
Yes, that's right.
But I love the fact that New Zealand wants to honor and kind of with that treaty has a mandate to protect its local Indigenous people. And I think that, that vision, I would love to be a part of your diverse work population, not just in terms of promoting and protecting and helping to achieve self-determination for the local Indigenous population, but just for the people of New Zealand, to be able to translate my skills and my passion into your diverse workforce, being part of a multidisciplinary team, contributing what I have harnessed over the years in terms of assessment, diagnosis, and therapeutic intervention skills to serve your people. And I love that New Zealand offers the opportunity, regardless of religion, regardless of skin color, regardless of race, to have that opportunity. And that makes me exceptionally keen on being part of that diverse workforce and contributing in those ways.
I'm sure you'll find exactly what you have described. Thank you, Suhaila, for your time, and I look forward to supporting you on your way towards.
Thank you so much. Incredible gratitude. Thank you so much.